Now we can break these down and look at them by pathology, because the previous slide basically looked at all patients combined into one group. Here we see the data broken down into loose body removal, to debridement of the ligament teres, osteophytic excision, and microfracture and the chondroplasties. And we can see when we look at pre-op versus post-op, all of these show improvement from the beginning to the end. Now clearly the greatest amount of improvement is when we remove loose bodies. And that goes back to what I talked about earlier. If you get rid of the mechanical irritant or the problem with inside the joint, oftentimes restoration of function is real easy to come back to. If you look more to the right-hand side of this graph, there's more biological healing that has to take place with labral repairs and or microfracture or chondroplasties, in which case now we're dealing with secondary healing that takes place. So there's not as much improvement, but there's still a significant difference between pre-op and post-op scores. This is just one other way of looking at it, and this is for the sportsman, where we can compare recreational athletes to high school athletes to collegiate athletes to elite athletes being Olympians and the like with that, and then professional athletes. I think one thing that's kind of interesting to note with our scores pre-op and post-op is that the amount of improvement with our elite and professional athletes is minimal. Now, I think that's a little bit misleading when we look at the bar graphs here, in that professional athletes or elite level athletes are probably already functioning near their physiological limits of the body. Therefore, the amount of room for improvement in these individuals is minimal compared to a recreational athlete that has considerable room for improvement.